everyone, it's Anne Marie again, and I'm joined yet again by Gypsy, who is my love now. She's actually trying to take the place of my Bobby Chin to get me through cancer. All my babies are good, but she's been especially good for me, so it's very, very important to always have a great support system, which obviously I have my babies as well as my wonderful husband, Philip. We did have a rough spot today, had to go to work and also deal with some issues with getting my pathology reports, my films, my biopsy results, my ultrasound. It's just one thing after another that they don't seem to have this anymore. Nobody knows where it went to, but luckily Philip was able to help me with that, and I highly recommend if you have someone in your life who can help you with it, let the stress be taken off of you. It's really hard for the people that love you and that are surrounded by you, but it gives them a reason to be in the picture. They know that they're important, but it gives them the purpose, and they know that they're helping greatly, which is a big help to me, so I can continue to work and de-stress myself that way and just feel like I'm a necessary and viable person in society. Besides possibly being a burden, that's always a fear. I don't want to burden anyone in my family or anybody, so I really find it important to still continue to work, even though some of the time I've had to take off. And luckily I'm back to full schedule now, but I'm only a few days away from my surgery. So I'm getting excited about that, and really it is a blessing. I know a lot of people don't understand that. I know a lot of people going through this won't ever understand that. That's not how they're looking at it, and that's fine. That's how you take it. But understand there's so many things that I've been through that I would never have experienced without having this cancer. And so far, except for having cancer, everything's been fantastic. I've met some really great people. I've had some wonderful experiences that have happened that had nothing to do with people. That were just things that occurred in my life that I'm very blessed with. And I'm really, truly looking forward to the next stage in getting this cancer staged. Instead of the clinical staging, we're going with the surgical staging. And that's going to determine what stage my cancer is actually at. I tried very hard not to do any real searching on the internet because I don't want that to scare me or make me question what's going on. I'm trusting my oncologist with doing limited research with some of the great groups that are out there, including the Mayo Clinic. That's one that I've been following. MD Anderson has some good information, and obviously the American Cancer Society as well. I've been following them and just checking out little questions that I have that I don't necessarily want to bother the oncologist with, and if it's something that I feel that it's necessary to bring up to her, which I typically do, I go ahead and give her a call. And it's really cool when you actually have your oncologist's cell phone number. That's been a good thing to have. I've been able to reach her twice when I really needed to. Luckily, the night sweats, it looks like, and the neuropathy, we're hoping are going to pass within a couple months. I'm now taking B12 to help with that. And at this point, we've only got a couple days now under my belt with that. This is my third day taking the B12, but it's hopefully going to boost the metabolism back up to a normal level and be able to take that pain in my feet and legs away, as well as get rid of these surges that I keep experiencing, because I'm not ready for menopause. I'm too young, and I don't care to deal with this any longer. It's really a challenge, but it's okay. It's just all a part of it, and that's fine. I don't have a problem with it. It's just that it takes you aback when all of a sudden your temperature rises so quickly and you begin to sweat profusely on your head and you have to dab. Women don't wipe, they don't smear, they dab. Anyway, again, just looking forward to going into surgery. I've only got a few more days. Some good friends have offered to actually go with me and to help Philip in any means necessary. So it's always good to have that support system there. That's one thing that I cannot stress enough, is to just let the people be there for you. That's something you're going to need. You may not think you do, or you may think you need it more than you do. but allow them to do that for you as well as they're doing it for themselves. And again, making them just a part of this is a big, big part of my being positive and continuing on this journey. And I sincerely hope that you will continue to follow my progress and see what the next stage brings. Again, you can always go to www.mypinkribbonjourney.org to see any updates and to continue to watch the videos. And again, we will be making more of these as we progress. So again, please join us at www.mypinkribbonjourney.org. We'd love to see you. And please feel free to let me know if you have a question. And I'm not an expert, and there's not everything that I have experienced that you may be experiencing or that a family member is experiencing. But just to have somebody to talk to keep them positive and maybe find that direction they need to go into. You know, I may be able to do the research or may have already done the research with this. So we really want to get everyone educated, get them the right doctor. If it's a doctor that you're questioning, get a second opinion. There's nothing wrong with that. This is your life. So you need to do what you need to do to make yourself comfortable, keep yourself alive, and in good physical health. So I hope to see you soon, and thank you so much for joining.